Hey, my name is Jorge Hernandez, and my presentation is on nitrous oxide use among young adults and adolescents. What is nitrous oxide? It is a colorless gas that is also referred to as NOS or laughing gas. It is currently used in the medical field as anesthetic for surgery and other treatment, especially when you go to the dentist. It is also commonly abused as an inhalant. When abused as an inhalant, its side effects include, but are not limited to, feelings of euphoria, dizziness, and lightheadedness. Long-term effects for those that abuse nitrous oxide in excess include vitamin B12 deficiency, which typically leads to damage to your neurological system, peripheral neuropathy. In some cases, it can even lead to spinal cord damage, and it can also lead to other neurological damages and diseases. Severity of nitrous oxide abuse. When abused as an inhalant, it is commonly abused by younger people. In a study done in a hospital in China, it was recorded that out of 61 patients that abused nitrous oxide, the majority of them were between the ages of 20 to 24. 34 out of 61 patients, or 55.7% of those in this study, were in that age range. Its accessibility, coupled with simple use, allows for it to be abused more frequently, especially among young adults. It is generally transferred from small metal canisters into balloons, allowing for an easy and simple way for those that wish to use the substance to get high. And according to a study by Mohammed Al-Sawi, it is stated that in the last 2 decades, nitrous oxide misuse increased exponentially, especially among young adults and medical professionals, likely due to its easy accessibility, its low costs, and pleasurable side effects. As stated before, vitamin B12 deficiency and other neurological diseases result from long-term effects of abuse. And according to a report by the National Institute for Occupational Safety, even in a controlled medical environment, those medical workers exposed to the gas for long periods of time could suffer from impaired fertility among female workers. It's not only damaging to those that abuse it, but long-term exposure to medical workers are also at risk. Treatment for nitrous oxide abuse. When it comes to nitrous oxide abuse, there appears to be little treatment that are offered. The main option for those that periodically abuse nitrous oxide is to stop inhaling nitrous oxide altogether. And for those that suffer from vitamin B12 deficiency as a result of nitrous oxide abuse, they are given treatment in the form of vitamin B12 supplementation. In a study by Eric Evans and Evans Matthew in Australia, it is stated that in 2020, the South Australian government acknowledged the public health risk and passed legislation to ban displaying canisters in shops, selling them to minors, and selling them after 10 p.m. Other than cases where the substance is made less accessible to the public, there are actually very little prevention programs in place to stop those from abusing nitrous oxide as an inhalant. And this concludes my presentation on nitrous oxide abuse among young adults and adolescents.